Beverly Hills, land of the rich, home of the famous. Sure, the stereotypes exist, but what most people don't know is the truth behind the plastic. If there is anything I have learned in all my years as a plastic surgeon, it's that appearances are not always as they seem. I get patients from all over the world, from celebrities to the average everyday housewife. But there is one thing they all have in common. Everyone needs a lift. Welcome to my world.
I'm a model and also an actress in North Hollywood. Well, when I was a kid, I was playing outside and a baseball hit me in my nose. And ever since then, I had a bump on my nose that I guess I tried to ignore, but then as I started to work more in Los Angeles, they started drawing a little white line on my nose to make it straight. And then that's when I really saw that I have a bump around my nose as well as on top. And since I work a lot with my looks, I felt like it's best that I really have my nose fixed and have the bump removed. Well, I try to live a really healthy lifestyle. I run a lot and I work out a lot, and I can't breathe on the left side of my nose. I feel as if how I breathe has really hurt my performance. I was referred to Dr. Kassabian through a good friend of mine, Lanisha. She had some work done and she looks fabulous, and I know he's gonna make sure I look absolutely gorgeous. I'm really looking forward to meeting with him so we can talk about what my options are.
Today I'm meeting with Phire. Phire is a client of mine who's a big fan of our spa services, especially the red carpet facial and the injectables. Today she has a more specific concern that she wants to discuss, so let's see what she has to say.
Today I'm here at LiftMD because I want to talk to Dr. Kassabian about having rhinoplasty done. And while I'm here, I'm actually thinking of having a breast augmentation. I really feel like it will enhance my look. Since I do work in Los Angeles, you always want to look your best. And so that's one of the things that I'm going to talk to him about, and I'm really excited.
Hi.
Hi, how are you?
Nice to see you.
Oh, thank you, same here.
What
Really?
brings you in today? Tell me.
Well, I want you to take a look at my nose. As a kid, I got hit in the face with a baseball.
Oh wow.
And
I'm
it's
sorry
left a
about
little
that.
bump there. I mean, it hurt a lot, but I think as I grew up, it started to leave a bump. And also, I think it affects how I breathe, and I like to work out a lot. So I'm really, I really want you to take a look at that, see if I can straighten it out a little bit.
Sure.
And then also, I would love to have a larger breast. I've been really thinking about it, and throughout the years, I felt like I want to feel more fuller, on top. Since I do work out a lot, I really focus on how I look and my shape, and of course, I act and I do print work, so I think that it would really help me in the long run.
Yeah, absolutely. Well, you're beautiful, but if these are concerns of yours, there's simple solutions to take care of them.
Okay.
Right? What I'd like to do next is check your breathing, check to see if there's a deviation of the septum, how your turbinates are, and then also we'll do the sizing of your breasts and go on from there.
Okay. Well, thank you.
Sure.
I'm excited.
So your septum's deviated to the left side. Big turbinate there.
Is it really bad?
I mean, it's going to make your breathing a lot better.
Because I can definitely feel that there's a bump there, like all
absolutely.
around. Yeah.
Absolutely. Yeah. So this is going to be shaved, narrower, and then this is going to be shaved. Yeah. Absolutely.
Okay. Good.
Sure.
I'm excited. I knew there was something up.
Up some more. Turn up just a little.
Okay, Phire. So what size are you looking to achieve?
More like a C, maybe a full B.
Okay, so you still want to get some implants, but you want to achieve a natural look and just fill out a little bit more.
Yes, exactly.
Okay.
I still run and I like to play sports, but I also just want to look great and feel great.
I understand. So right here I have 2 implants.
Okay.
They're both silicone. One is a 250cc and one is a 275cc. Not much bigger than the 250, and you'll achieve a nice C.
Okay.
Because you have a smaller frame, so we're going for a nice, more natural implant for you. Size.
Now, will this maintain the same shape of my breast that I already have?
Exactly. They'll just fill it up and give you more volume.
Okay. Sounds good. I'm not sure which size, but I'm sure they'll both look great.
So why don't we do this? Why don't we do some sizing? And we can
Okay.
see how it looks and how you feel with them in.
Okay, sounds
Okay.
good. I'm ready.
Great. What do you think?
I like it.
Yeah?
For some reason, I feel like, I think I look full, and I think it gives me shape from the front, but it seems like from the side, it's not as much.
You want to see a little bit more of a curve?
Yeah, I would love to see the larger size just to make sure.
Okay, well, let's try it.
Okay.
Okay, Phire. Well, this is a 275 cc's.
Okay.
Gives you more of a shape. Your waist looks even smaller than it
Yeah.
is, which you really don't need. And then check out the side view.
Okay. Yeah,
Got that
I
nice
definitely
S
see-
shape going on.
Mm-hmm. I definitely see a change, and it looks really good. So I don't know.
I like
I'm ready. Yeah, it does. I see more of a shape in my waist, and I think it gives me a bit of the hourglass look, and not so much of like the athletic type of look. So
Yeah, it looks good. I think we got our size.
Okay.
Well, I'm glad that you guys did the sizing and chose the size that's most proportional for
Yeah.
your height, weight, because I want you to look great in your bikini and
Yeah.
lingerie shots.
Thank you.
And then the nose, first I'm going to do the septoplasty. You have a deviated septum
Okay.
and make your turbinate smaller so you'll be able to breathe better. Then shave the hump, make the nose less wide, both from here in this area and also on the bottom here.
Okay.
Make it softer because you have delicate features, and with the hit that you got, made your nose wide. So need to bring that fine details back.
Wow.
So we'll do both surgeries together. One recovery. That's perfect.
Oh yeah, that's
Yeah.
good. So how long will it take me to get back to me after all?
The nose, you're gonna have a bandage, a splint on it for about a week.
Mm-hmm.
That comes off. Initial swelling is gonna be another couple of weeks.
Okay.
Figure in about a month you'll look very good.
Okay.
And then
Ready for
with the
summertime.
breast, yeah, that takes some weeks for it to settle into
Okay.
position.
Mm-hmm.
And again, within a month you're gonna look fantastic.
Okay. Well, I'm ready.
Okay,
Thank
fantastic.
You so,
So
much.
nice to see you.
I know. Nice to see you.
So
Thank
I
you
want
so
you to
much.
meet with the patient coordinator and
Okay.
schedule a date that's most convenient for you for the procedure.
Okay. Well, I'm ready.
Fantastic.
Thank you.
Sure. Just got done meeting with Phire. She has two concerns. First, her nose, and second, her breast. As far as her nose is concerned, she was hit when she was 8 years old with a baseball bat. Therefore, she grew with a crooked nose and difficulty breathing. Her difficulty breathing is due to deviated septum and also enlarged turbinates. Also, from the outside, she has bumps and also flat nose on the tip and wide nostrils. My plan for Phire is to perform a septoplasty and turbinectomy to improve her breathing, and also to perform a rhinoplasty as well as a nostril reduction in order to improve the aesthetic results of her nose. Phire's second concerns are her breast. Being a swimsuit and fitness model, she feels that the size of her breasts are not proportional to the rest of her body. Phire is interested in breast augmentation to achieve a fuller look so that she can look better when she's modeling for lingerie, swimwear, and also everyday life.
So today's the day. I am about to get my nose done, and also I'm going to get my breast done. I am thrilled, and I know I'm in really great hands. I'm just really looking forward to being able to run and being able to breathe the right way, and also excited about how I'll look once I'm done. I trust the doctors. I'm really thrilled about my results, and I am excited.
Good morning, Phire.
Good morning.
How are you?
I'm great. Excited.
Well, it's an exciting day.
I know.
Yeah. Let me explain to you what we're gonna do. We're gonna start with the rhinoplasty. You have a deviated septum. That's why you have difficulty breathing. and also that your nose is crooked on the outside. So I'm gonna start by fixing the deviated septum, make it as straight as possible. Your turbinates are big; those are the filters on the side.
Okay.
Those are also gonna be shrunk down.
Okay.
And then on the outside, you have some bumps, crooked areas. So I'm gonna fix those, make the nose less wide in this area and less wide in this area. So you're gonna breathe better and look better.
I know, I'm excited.
All right. And then the breast augmentation, it's gonna be gel implant. Your desire is to be like a full B, small C.
Exactly.
Yeah. You'll recover within a week with both of them.
So I can go and run after next week?
No. You need the thing about breast implants is you need to baby them in the beginning.
Okay.
If you're good to them, then they're gonna be good for you.
Okay.
For throughout your life without an issue. If you do too much in the beginning, then you're gonna get into swelling
Oh wow.
and scarring. I don't want you to be doing that. But I will show you how to do massages earlier on
Okay.
and maintenance so that they'll heal as expected.
Okay.
All right?
I'm ready.
If you have no further
I trust
questions,
you.
give me a hug and let's start.
Okay, thank you.
Take a deep breath. Starting Phire surgery. First, I'm going to be performing the breast augmentation with gel implants. The breast augmentation is done first because that involves an implant and it needs to be super sterile. So start with that, and then it's going to be followed by the rhinoplasty. I'm done with the breast augmentation part of the procedure. Put in gel implants under the muscle. The procedure went very well. Next, I'm going to proceed with the rhinoplasty. First, start with the septoplasty, the turbinate parts, then the cosmetic portion. Let's go ahead.
This holiday, lift your loved ones' spirits and give them the gift they really want. The gift of beauty from Beverly Hills that only LiftMD can deliver. Choose from our menu of spa services, including facials and peels, facial rejuvenation with Botox and fillers, nose refinement, breast enhancement, liposuction, tummy tuck, our mommy makeover, and choose from LiftMD's exclusive line of beauty products. Why wait? Call today and we'll wrap it and personalize it for you. This holiday, give your loved one the gift of looking good and feeling good. Who says beauty can't come in a box?
I just completed both procedures for Phire. First, I did the breast augmentation with gel implants under the muscle. That was followed by the rhinoplasty, septoplasty. Both procedures went very smooth, as expected, and I'm sure Phire is going to be thrilled with the results when we unveil the results in a week. Hi, Phire.
Hi.
How are you?
Good, how are you?
You look amazing.
Thank you, I feel
Wow.
amazing.
Wow.
So.
It's been 3 months now. And tell me.
Everything healed great. I feel awesome. I started to run again. And my agents love how my look is. So
Yeah.
I'm so happy.
Yeah, I can't stop staring at your nose.
Thanks.
And you can't tell anything. The scars healed really well, even though we did the ALR wedge reduction, the nostril reduction. But it looks very, very nice. It looks very natural.
Yeah, no one can tell. They always ask me like, what's up? I see a slight change, but then they just say that your face looks really soft and my eyes look really big.
Good, good.
So I'm really excited.
Fantastic. And the augmentation, it compliments
I know. Thank you so
Nice.
much.
Yeah.
They're perfect. I can still kind of wear some of my old clothes, but it's been great having to shop for new bikinis.
you. What cup size are you now?
32C.
Okay.
So I went up exactly 1 cup size and I haven't gained weight.
Okay.
So that was awesome too.
That's perfect for your size. You know, complements your shoulders, hips, your figure. Very nice.
And it makes my waist look smaller.
Fantastic.
So-
Okay, so I'm gonna take some photos and
Okay.
do a quick exam. All right.
Okay, sounds good.
Chin down. Put your head behind your ears, just Everything's looking great. I'm very happy with the results, and I'm sure you're happy too. I know you're going back into the exercise mode.
Yeah.
If you want me to talk to your trainer to give guidelines on what you can and what you can't do, because it's only been 3 months and you're still in the healing phase, I'll be happy to do that.
I would love that because I really love to run and so I'm excited to.
Fantastic. Okay, all right, so nice to see you.
Thank you so much.
Phire's healing very well. Her breathing is much improved, and cosmetically, she's very pleased, and it's proportional to her face. As far as the breast augmentation, Phire is pleased with the results and the proportions the augmentation gave her. In the next few months, the swelling of the rhinoplasty and the breast augmentation will continue to reduce. This will make the results even better, and I'm sure Phire will be thrilled.
I am so thrilled that I made the choice to have my nose done as well as have my breast augmented. They look gorgeous and my mom is really pleased with my nose. And that's the one person I really had to please. My agent is so pleased with how everything turned out. I actually went to a client that I went to see last year, and 1 year after, which was 2 months ago, they hired me for the same exact job that they turned me down for a year ago. So I'm really pleased with my new look. It's gotten me more work, I've definitely made more money, and I'm just in love with the way that my nose looks. I feel like my skin looks really soft. Everyone comments on my eyes now. And I fit into every swimsuit and shirt that I could never wear before. I am so pleased. I have to say thank you to Dr. Kassabian.